Alright everyone, hold on to your passports because what I'm about to share with you today is going to completely change how you think about air travel in 2026. If you're over 50 or you're helping someone who is, this video could save you thousands of dollars and potentially even save a life. I've been digging through the latest regulatory updates, and let me tell you, the travel industry just dropped some massive changes that most people have no idea are coming. We're talking about rules that will affect everything from what you can pack in your carry onto how airlines handle medical emergencies at 35,000 feet. But here is the thing that really caught my attention. Some of these changes are incredible wins for mature travelers, while others introduce new requirements that could catch even the most experienced flyers completely off guard. And the number one change on my list. It's going to fundamentally transform travel insurance for anyone dealing with chronic health conditions. So today, I'm counting down the 10 most critical airline health rule changes that every traveler over 50 needs to know about before they book their next flight. From surprising airport upgrades to new medication policies that could make or break your trip. These updates are reshaping the entire travel experience for mature adults. Let's jump right into it, starting with number 10. And trust me, by the time we get to number 1, you're going to understand why 2026 is being called a game-changing year for senior travel. Number 10. Finally, no more dumping your expensive medications at security coming in. At number 10, we have what I'm calling the biggest relief for anyone who's ever watched TSA throw away their $300 insulin. This is huge news for anyone who travels with prescription liquids. Starting in 2026, security authorities in the US and Europe are dramatically increasing the amount of prescription liquids you can carry in your hand luggage. We're talking about going from the old 100 milliliter limit that caused so much stress and confusion to a whopping 2 liters of prescription liquids. Think about that for a second. That's enough space for insulin, saline solutions, eye drops, and even certain nutritional supplements prescribed by your doctor, all in one trip. But here is the catch, and this is important. Everything needs to be crystal clear in terms of documentation. Your medications must be in their original packaging, clearly labeled with your name, and you'll need either a doctor's note or an approved digital medical profile to back it up. Security agents can still test your containers, but as long as you have your paperwork in order, you won't face that heart-stopping moment of watching your vital medications get confiscated at the checkpoint. This change alone is going to eliminate so much anxiety for travelers who depend on liquid medications to manage their health conditions. Number 9. The documentation mistake that gets medications seized. Number 9 brings us to something that's going to require a bit more preparation on your part, but it's absolutely worth understanding because getting this wrong could ruin your entire trip. Prescription documentation and digital medical profiles are becoming mandatory for all travelers over 50. Airlines and airport security are now requiring that every single medication you carry be in its original pharmacy container, with clear labels showing your name and prescription details. But that's just the starting point. Every medication must be supported by a physician's letter that includes your full name, your diagnosis, each medication you're taking, the dosage, and your prescribing doctor's contact information. If you're more tech-savvy, you can use approved digital health profiles that display the same information through QR codes verified by transportation authorities. This might sound like bureaucratic overreach, but there is a real purpose here. These requirements are designed to prevent medication seizures and confusion at international borders, especially when you're carrying controlled substances or medications that might not be immediately recognizable to security personnel. Skip this paperwork and you could face significant delays, medication confiscation, or in extreme cases, being denied boarding. The focus has shifted from just worrying about volume limits to making sure every pill and liquid in your carry-on is properly documented before you even leave home. Number 8. The one page medical sheet that could save your life. At number 8, we're talking about a simple piece of paper that paramedics are calling a lifesaver. The new guidelines are recommending some specific packing strategies that can make your airport experience much smoother and potentially save your life in an emergency. First, use a clear zippered pouch for all your prescription and over-the-counter medications. This makes it easy for security agents to inspect everything without having to handle each individual bottle. Time-sensitive medications like insulin or heart medications should always be packed at the very top of your carry, on never-in-checked luggage to avoid delays if your bag gets held up. Here is a pro tip that travel clinics are now recommending. Include a one-page medical summary right in your medication pouch. This should list your diagnosis, any allergies you have, and emergency contact information. If you need help quickly, this simple document could be a lifesaver. Travel experts are also suggesting keeping backup prescriptions and a small supply of critical medications in a separate pouch, just as an extra safety measure. This approach not only speeds up airport screening, but ensures you have everything you need within reach throughout your entire journey. Number 7. The airport service nobody talks about for seniors. Number 7 introduces something that I think is going to be a game changer for many travelers, yet most airports aren't advertising it. Airport medical assistance zones are being established at major hubs across the US and Europe, and they're specifically designed to help travelers over 50. These aren't just information desks. We're talking about staffed zones that provide hands-on assistance with everything from medication refrigeration to helping you set up medical devices before your flight. If you depend on insulin that needs to be kept cold, oxygen equipment, or a CPAP machine, these zones offer secure storage and a quiet space to get everything ready instead of scrambling at your gate. The staff in these zones are trained to be multilingual and can coordinate with airlines for in-flight accommodations. They can even connect you to medical hotlines if you need a doctor's input before boarding. Plus, there are fast-track security lanes linked to these zones, so you can bypass standard lines and get assistance exactly where you need it. Now, I have to be honest with you, the rollout isn't perfect yet. Some airports are still ramping up, and there have been staffing and funding issues causing uneven service in the early months of 2026. My advice is to check your departure airport's website or call ahead to confirm zone hours and available services, especially if you're traveling with specialized medical equipment. This represents a real shift from expecting travelers to manage everything on their own to airports providing genuine hands-on support, making the journey safer and less stressful for mature passengers. Number 6. The free companion pass airlines don't want you to know about. Coming in at number 6, we have the companion gate pass, and airlines are definitely not advertising this one. Starting in 2026, passengers aged 50 and above can request a gate pass for one companion to accompany them through security all the way to the boarding gate, completely free. This means you're no longer left to handle the maze of terminals, security checks, and last-minute gate changes by yourself. The Department of Transportation now requires airlines to make this option available, but you need to request it either during booking or at least 72 hours before your flight. The process is straightforward. You submit your companion's full name and government, issued 499 information, and the airline issues the pass for use on departure day. Keep in mind that some international airports may have different rules, so it's smart to double-check if your journey includes international connections. This gate pass is separate from wheelchair or medical escort services. It's designed for travelers who don't need physical assistance but want emotional support and an extra set of eyes and hands to help navigate the airport experience. This small change is already reducing stress and confusion for mature travelers, especially those managing complex medication routines or simply feeling overwhelmed by crowded terminals. With a companion by your side, the journey through security and to the gate becomes much more manageable and reassuring. Number 5. You're probably overpaying $300 for medical device transport. At number 5, here is something airlines have been quietly implementing that could save you hundreds of dollars. Airlines must now provide priority handling and free checked baggage for all medical devices and equipment. This means your CPAP machine, portable oxygen concentrator, wheelchair, or any other medical device doesn't count toward your baggage allowance. If you've been paying extra fees or struggling to fit everything into your carry, those days are over. Airlines are required to transport these devices free of charge, whether as carry, on, or checked baggage, and they get priority handling to ensure they arrive with you at your destination. No more arriving at your hotel only to find out your CPAP is still 3 cities behind. The key is to declare your medical equipment at check. Don't try to sneak it through as regular luggage. Be upfront about what you're carrying, and the airline must accommodate you without additional charges. This change alone can save mature travelers $100 to $300 per round trip, depending on the airline and the amount of equipment you need. It's a significant financial relief for those who depend on medical devices to manage their health conditions while traveling. Number 4. The priority boarding secret you didn't know you qualified for. Number 4 might surprise you because most seniors don't realize they automatically qualify for this. Airlines must now provide early boarding to any passenger over 50 who requests it due to a medical condition or mobility concern. You don't need a wheelchair. You don't need visible mobility aids. If you have arthritis that makes standing in line difficult, if you need extra time to get settled with your medications, or if you simply need to avoid the stress and pushing of general boarding, you qualify. The beauty of this rule is its simplicity. When you check in, either online or at the counter, just select medical boarding assistance. No doctor's note required, no lengthy explanation needed. The gate agent will call for early boarding, and you'll be in group 1 or 2, getting on the plane before the chaos begins. This gives you time to properly stow your medical supplies, get your medications within reach, and settle in without feeling rushed or overwhelmed. For travelers with hidden conditions like heart disease or breathing issues, this extra time and reduced stress can make a huge difference in starting your flight comfortably. Airlines that fail to honor this can face significant fines, so don't be shy about requesting what you're entitled to. This isn't about cutting in line. It's about ensuring mature travelers have the time and space they need to travel safely. Number 3. What flight attendants can now do that could save your life. Coming in at number 3, this change addresses one of the biggest fears mature travelers have, having a medical emergency at 35.0 feet. Airlines are now required to carry dramatically expanded medical kits, specifically designed for senior health emergencies. We're not talking about basic first aid anymore. Every commercial aircraft must now stock insulin, nitroglycerin for heart attacks, stronger antihistamines for severe allergic reactions, blood sugar testing equipment, enhanced oxygen delivery systems, and even temporary cardiac pacing capabilities. These aren't token supplies. Airlines are required to meet detailed regulatory kit requirements that now mirror what you'd find in a well-equipped emergency room. Flight attendants are no longer just trained once during their initial certification. They're completing quarterly drills focused specifically on responding to cardiac events, diabetic crises, and severe allergic reactions. According to reports from cabin crew, most in-flight medical emergencies involving mature travelers happen within a 6-minute window where fast access to the right medication is absolutely critical. The new rules mean flight attendants are prepared to stabilize a passenger until the plane can land or a doctor on board can take over. For many older adults, this change addresses the biggest worry about flying. What happens if Teresa's serious health crisis at 35.0 feet? With these expanded kits and better training, The gap between a mid-air emergency and real help is finally closing. Number 2. The $50 wellness kit airlines must give you free. Number 2 focuses on something airlines are now required to provide, but aren't exactly advertising. Airlines are making proactive wellness the new standard for in-flight comfort and health, especially for travelers over 50. Starting in 2026, every long-haul flight will supply hydration kits and compression socks to mature passengers as part of a comprehensive wellness program, completely free. Cabin crews are trained to distribute bottled water, electrolyte packets, and medical-grade compression socks within the first hour of boarding, with extra supplies available on request. For those concerned about deep vein thrombosis or leg swelling, these compression socks aren't just a courtesy gesture. They're backed by medical research showing real reduction in clot risk on flights over 4 hours. And at $30, $50 retail value, getting them free is a nice bonus. Airlines have also formalized the right to request extra legroom or aisle seats for mobility and circulation concerns. You can select these options at booking or during check, and simply by stating a need for senior seating assistance. On flights lasting more than 3 hours, new rules require guided stretching and movement videos to play every 2 hours on the in-flight entertainment system. These routines are designed with input from physical therapists and focus on gentle movements you can do right in your seat to keep blood flowing, reduce stiffness, and help you arrive feeling less fatigued. For travelers who want to be even more proactive, some carriers now offer pre-flight wellness briefings through their apps with personalized tips based on your health questionnaire responses. Number 1, the insurance rule that changes everything for seniors. And finally, at number 1, we have what I consider the most shocking and significant change in decades for mature travelers. A sweeping new requirement that's reshaping the entire travel landscape for anyone over 50, and most people have no idea it's happening. Baseline travel insurance must now include emergency coverage for pre-existing conditions. Let that sink in for a moment. This means every airline ticket purchased after January 1st, 2026 comes with an insurance policy that covers sudden flare-ups of chronic illnesses like diabetes, heart disease, or asthma while you're traveling abroad. The days of worrying about being denied care or facing massive medical bills if your long-managed condition takes a turn for the worse are coming to an end. Major insurers have rolled out clearly marked senior-ready plans that are easy to compare, so you know exactly what's included before your trip. Under the new rules, all policies must pay for emergency stabilization and hospital care if a chronic issue becomes urgent, even if you've had the diagnosis for years. Tiered pricing is allowed, so premiums may be higher for travelers with more complex health histories, but basic protection is mandatory. No more hidden exclusions for the very conditions most likely to cause problems during travel. There is one requirement you need to know about. You'll need to confirm your coverage at least 3 days before departure, either through your airline's booking portal or directly with the insurer, to make sure your specific medications and diagnoses are listed on the policy. If you already have insurance through a private plan or Medicare supplement, you can opt out, but you'll need to show proof of comparable coverage. This requirement closes the last major gap in the safety net for mature travelers. Following years of advocacy and hard data showing that medical emergencies abroad are both more common and more costly for this age group, this safeguard dramatically reduces the risk of being stranded without help or facing financial ruin over a medical crisis. For the first time, older adults can plan international trips, knowing that if the unexpected happens, they won't be left to navigate foreign hospitals or insurance systems alone. It's a change that brings real peace of mind and crowns the 2026 health rule reforms as the most consequential shift for senior travelers in decades. So there you have it. From the expanded liquid medication allowance at number 10 to the sweeping mandate for travel insurance covering pre-existing conditions at number 1. These 10 airline health rule changes paint a clear picture that 2026 is truly a transformative year for travelers aged 50 and above. The most surprising developments, like staffed medical assistance zones at airports and free priority handling for vital medical devices, signal a shift from isolated fixes to a comprehensive, layered safety net. Looking across this entire list, one pattern stands out clearly. Each rule builds on the previous ones, moving from personal responsibility like documentation and smart packing to systemic protections like airport infrastructure and mandatory insurance coverage. As the number of mature travelers continues to rise and in-flight health incidents gain more attention, these rules reveal a new era where airlines and regulators are prioritizing prevention, rapid response, and financial security. Together, these changes ensure that for seniors, air travel in 2026 will be safer, more accommodating, and more predictable than ever before. The travel industry is finally recognizing that mature travelers have specific needs and deserve specific protections. If you found this breakdown helpful, make sure to subscribe for more travel updates and share this video with anyone over 50 who loves to travel. These changes are rolling out throughout 2026, so staying informed could make all the difference in your next journey. What change surprised you the most? Drop a comment below and let me know which of these new rules will have the biggest impact on your travel plans. Thanks for watching, and I'll see you in the next video.